He was supposed to protect the public, not use federal power for revenge. The man running America's drug approvals has just resigned under investigation for serious personal misconduct. And the timing, the same day a major pharmaceutical company accused him of taking its stock in what they're calling a personal vendetta.
The FDA's top drug regulator says the work environment there is toxic. Dr. George Tidmarsh was placed on administrative leave and is considering resigning after he says he criticized a new regulatory process at the FDA. A Health and Human Services spokesperson says Tidmarsh, who leads the FDA Center for Drug Evaluation and Research, was placed on leave because of serious concerns about his personal conduct. Tidmarsh has denied the allegations.
This isn't just another Washington scandal. It's a glimpse inside an FDA that's starting to look dangerously unstable under a health secretary whose leadership is already under fire. If the agency that decides what drugs are safe can't even control its own house, what happens to the rest of us? Something serious just happened inside the FDA, the agency that decides which medications make it to market. The head of its entire drug division has abruptly resigned after federal officials launched a review into what they called serious concerns about his personal conduct. Dr. George Tidmarsh, who only joined the FDA in July, was placed on leave last Friday and resigned 2 days later, on Sunday morning. The announcement came from the Department of Health and Human Services, which oversees the FDA. An HHS spokesperson said the department's general counsel was alerted to the issues late last week and moved quickly to investigate. Press Secretary Emily Hillard said Health Secretary Robert F. Kennedy expects the highest ethical standards from everyone serving under his leadership and remains committed to full transparency. But what makes this more than just a sudden resignation is the timing. Tidmarsh's exit came the very same day that Aurinia Pharmaceuticals, a Canadian drug company, filed a lawsuit accusing him of using his own government position to pursue a personal vendetta.
Federal officials announced Tidmarsh is on leave over concerns about his personal conduct. And Stat News, which is a health science and medical publication, specifically reported that he was accused of using his authority as a regulator to financially harm a business associate. And coincidingly, a pharmaceutical company based in Canada is now suing Tidmarsh, alleging he publicly criticized them on a social media website in an effort to intentionally tank their stock. Tidmarsh, as you mentioned, Perry, denies all of these allegations. He has since deleted that post that initially got him in a little bit of hot water with that pharmaceutical company.
Seems very MAGA administration, if you ask me. According to the lawsuit, Tidmarsh made false and defamatory statements about Aurinia and its leadership, particularly around board chair Kevin Tang, a former colleague and longtime rival. Tang had previously been involved in pushing Tidmarsh out of multiple biotech companies, including La Jolla Pharmaceutical. The company claims that Tidmarsh never let it go. The lawsuit points to a now deleted LinkedIn post from September where Tidmarsh publicly criticized one of Aurinia's FDA-approved kidney drugs, saying it had not been shown to provide a direct clinical benefit for patients. Within hours, Aurinia's stock jumped 20 points, wiping out more than $350 million in value. Tidmarsh later deleted the post and said he had made it in a personal capacity. But according to the lawsuit, the damage was done, and the company says his actions were part of a long-standing personal vendetta against Tang. The suit also accuses Tidmarsh of targeting another drug maker, American Laboratories, where Tang also serves as a board chair. Tidmarsh hadn't publicly responded to the new allegations. Messages to him and his attorney weren't returned. And federal investigators haven't released details on what prompted the HHS review. Before joining the FDA, Tidmarsh spent decades in California's biotech industry. He founded and led several pharmaceutical companies and taught as an adjunct professor at Stanford University. He was reportedly recruited after meeting with the FDA Commissioner Marty Makary earlier this year. His departure adds to a growing leadership crisis inside the FDA. The agency has seen a wave of resignations, firings, and internal turmoil in recent months, especially since RFK Jr. took over the Health and Human Services Department. Dr. Vinay Prasad, who heads the FDA Vaccine and Biologics Division, resigned in July after being criticized by far-right activists, only to be rehired 2 weeks later by RFK Jr. himself. And inside the drug division, Tidmarsh ran more than 1,000 staff members, and many have left in the past year due to layoffs or burnout or an exodus that's raised questions about morale, stability, and oversight at one of the most important public health institutions in the country. Tidmarsh denies any wrongdoing, saying he was punished for speaking up against a new FDA plan to fast-track drug approvals, a program that would cut months of scientific review down to a single day. He told the New York Times that he believed the plan was illegal and that objecting to it cost him his job.
Cordero is joining us now to talk about this. So Tidmarsh claims the move is in retaliation for speaking out against the FDA's chief medical and scientific officer. What exactly is the FDA saying Tidmarsh did wrong?
Look, just kind of taking a step back, he is an FDA regulator, one of the top ones, so he has a lot of power. There's no doubt about it. And the line of his complaints is within the regulatory world. So he says that he has criticized a new regulatory process at the FDA, which is designed to speed up the review process for certain things. And that is the red flag that he's raising. He said that that new process circumvents rigorous scientific debate, and Tidmarsh raised concerns over the process putting one person in charge of every drug approval. The HHS hasn't responded to those allegations.
That explanation collides with the lawsuit's version of events, which paints Tidmarsh as a powerful official using his position for revenge. Either way, the damage is clear and it's messy. The FDA's credibility is already under strain, and it just took another blow. And here's why this story matters. The FDA's power rests entirely on public trust. You don't see what happens behind the scenes. You just assume that when a medicine reaches the shelves, it's been tested and approved for one reason only, because it works and it's safe. But if the people in charge are caught up in personal drama, political agendas, or pressure to rush decisions, that trust disappears. Companies hesitate to invest in research. Doctors start questioning approvals, and patients, the people who rely on these drugs, begin to doubt the system that's supposed to be there to protect us. When politics and personal ambition and personal drama and ops creep into science, the cost isn't just scandal. We all pay the price. And I'm going to put a graphic up on the screen. States with high percentages of people receiving disability benefits, many of them Trump voters, will feel the sting if future eligibility is tightened. When regulatory chaos hits Washington, these are the communities that feel it first. They're the ones who depend on the system to function for medicine, safety, and survival. HHS says Tidmarsh has resigned. He says he's still technically on leave. But no matter how this shakes out, the damage has been done. The agency responsible for protecting public health is once again under fire, and Americans are left wondering, who's looking out for us? If the FDA can't stay above personal grudges and are getting spun up in their own political drama and influence, then the question isn't just who's in charge, it's whether the system itself can be trusted at all. And if you've enjoyed this video, please take a moment to subscribe. One Woman Show. Everything you see here is written, researched, cut, edited by myself and my dog, who is making a mess.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.